Hi there, and thanks for joining us. I'm Connie Tran. It's no doubt surgeries can have a huge impact on a patient's life emotionally, mentally, and physically. A new program offered at Community helps patients recover from surgery in the best way possible. Dr. Amir Fathi introduces us to the ERAS program, otherwise known as Enhanced Recovery After Surgery.
Hi.
As soon as Fresno resident Eileen Swift learned she had a huge mass on her pancreas in December of 2018,
the cyst was so large.
Dr. Amir Fathi suggested she have the non-cancerous cyst removed immediately.
He didn't want it to remain.
Fathi is the director of hepatopancreatobiliary surgery at Community Regional Medical Center.
Encasing our envelope.
He acknowledges surgery can take its toll on patients.
Think about it. Surgery is a really big insult in the body. We are really changing the physiology and anatomy of the body, and we're hoping that it's going to heal well and patients are going to go back to their normal life.
But Fathi says prior to 2017, he noticed surgery patients were struggling to get back to that normal life. He saw a high percentage of patients suffering from complications post-surgery. So he began to ask,
what can we do to improve the outcomes after surgery? Some part was technique, some part was the medical care.
In October 2017, Fathi and a number of other surgeons at community medical centers helped implement the ERAS program with eligible patients. The core concept of enhancing recovery after surgery is to optimize patients' medical conditions before they go into surgery, so when they come out, they suffer less complications, pain, and bounce back to normalcy quicker.
So when the dietitian sat down and spoke with me about ERAS, a lot of it made sense because you actually start on this immune boosting 5 days before the surgery.
Swift learned being part of the ERAS program ensured she would go into surgery nourished and hydrated.
We have a special supplementation we call immunonutrition that we give them to the patients to take prior to surgery to get them to a better nutritional health.
Fathi explains ERAS also makes sure patients are up to date on all their medications. They check to see if a patient smokes, and if so, they try to help them quit. Smokers often have a difficult recovery post-surgery. Lastly, Fathi says it's important to get a patient's glycemic index under control, all in an effort to reduce surgical and post-operative stress.
He said, we're going to give you your old life back just like it was, except you're going to have a fabulous scar.
Swift is one of more than 400 patients who have gone through the ERAS program since introducing it in 2017. Dr. Fathi is happy to report he's noticed in his patients
better outcomes, less infection, shorter length of stay, less readmissions, and then dramatic decrease in the narcotic pain medication usage.
Swift had 60% of her pancreas removed, but thanks to the ERAS program, she says she was eating 3 days after the surgery. And now 2 months out of that big operation,
I'm so glad that you're doing well.
I am too, thank you.
Life is great as ever.
I feel like I have all of my energy back. I'm not doing a lot of crunches yet.
The hope is to expand the Enhanced Recovery After Surgery program to all surgical patients in the Central Valley. If you'd like more information on the program or to see if you qualify, talk to your doctor.